Welcome back. Dr. John Bouras is the medical director and psychiatrist for the TMS Center. And first, can you tell us about this new technology and why it's so important?
This is an exciting time to be in psychiatry. There's so many new developments that are happening nowadays at such a speed. There is this new therapy called TMS therapy. It stands for transcranial magnetic stimulation, and this is a way to non-invasively, using magnetic energy, to access an area of the brain that controls mood and depression that does not function as well. And by accessing that, we stimulate that area and we get the neurons to fire more. You might be familiar with medications that tend to treat chemical imbalance.
Sure.
Well, when you take medications, you go throughout the whole body, and that's when you can have side effects.
Right.
This one is more of a targeted area in the brain, and it does help restore balance in those chemicals like neurotransmitters of norepinephrine, serotonin, or dopamine. It's very safe. It's non-invasive. You don't need to be sedated or anesthetized, and it lasts less than an hour. People come into the office, they can drive themselves. They come there, they stay awake and alert throughout the whole procedure, and then they can go on with their usual activities right away.
Right away?
Right away.
Right away. It's that fast.
There's no recovery time because there's no anesthesia.
Sure. And what a great breakthrough in this type of technology. So what exactly happens when this, on the pulses, when they go through the brain? What's going on?
This is based on a very well-established principle called Faraday's law. That's from our high school physics. But mainly when you have magnetic fields that we turn on and off, we're able to reduce a very small electric current that goes inside the brain, and that in turn helps the neurons to fire more. Neurons have action potential. So by doing that, we're able to release more of those neurochemicals. Now, having said that, this is a very oversimplified way to put it. We also are able to have distant, in more subcortical, some deeper structures in the brain, like the limbic system, some changes there, and that also improves mood and depression.
Well, you said earlier that, drug therapy, there's always side effects. Can someone get off of drugs completely with this type of therapy?
It's possible.
Wow.
In the clinical studies, actually, they took the people off of medication for 2 weeks before they can put them in the study. So that was very amazing. More times than not, when we do see the patients, they already have been trying to several medications. So this is not a first-line treatment, even though it could be. Patients usually have failed several medications, at least one of which was at a high enough dose and long enough duration. And those individuals are able now to respond. And in open-label studies, 1 in 2 patients actually are able to feel significantly better, and even 1 in 3 are 100% better, what we call remission, and that's our goal nowadays.
Is this a fairly new type of technology that's been tested?
The technology itself has been out since the 1980s. They are using it to map cortical areas, map areas of the brain. It has been studied since the mid-90s because people were feeling a little bit better with the technology.
Sure.
So we have had a lot more research. It has been used in Canada since 2003, and here in the United States we got the approval in October 2008.
Well, this is breakthrough technology right here in Victoria. Where else would someone have to go to get this type of therapy?
Well, this is a type of therapy that's usually given in bigger centers, bigger cities. And right now we are the only center south of I-10. And I felt this is a critical technology to bring to our crossroads area.
Sure.
Because for one, it has to be given on a daily basis, so people don't have to travel to the big cities. So they don't have to take time off work to do that. They can just come here to Victoria and able to, less than an hour, sit in a chair. Most people like it because they feel that they're in a spa. Some people even take a nap, but usually they like to talk, and then they can go on with their activities.
Yeah, 15 seconds. Is everyone a candidate for this type of therapy?
And not everyone is a candidate. And there are contraindications in the same way that somebody having to get an MRI. So nothing like metallic plates, metal clips, or defibrillators or pacemakers.
All right, Dr. Bouras, thank you so much for spending some time with us. Great technology, great information, and we look forward to